My name's Dr. Stephen Nicholls, and I'm a vascular surgeon and a phlebologist, and that means I'm a physician who specializes in the treatment of varicose veins. And I'd like to explain to you some of the ways that we manage this condition. And these treatments are divided into medical, which consists primarily of using compression stockings, and interventional, and I'll discuss both sclerotherapy and laser ablation as part of that consideration. Over here we can see a stocking which is specially designed and for which the leg needs to be measured. It grips tighter at the ankle than it does higher up, therefore it tends to promote passage of blood out of the leg. And this is excellent therapy for many people who find good symptomatic relief. For some people it has problems usually related to itching or intolerance because of sensitive skin, and in the summer it may be a little hot. However, as you can see, these are not the same stockings that your grandmother had to wear of the rubber type that were very, very uncomfortable indeed. For many people, however, they are inadequate for treatment, and we have various interventions which can be used as the next step. Interventions include sclerotherapy, which is very good for treating spider veins, which are those little tiny veins that you can sometimes see. And there's a solution injected through a very, very small needle, which causes the vein to shrivel and eventually to disappear. This solution may be made into foam, in which the same volume of solution will handle much larger veins. And this is better for those veins which we familiarly call varicose veins. The intervention of laser ablation involves replacing, for the most part, the old stripping operation. And I'm sure many people will recall a relative or a parent who had varicose vein stripping involving an anesthetic and incisions on the leg and sometimes convalescence for several days. Ablation is now performed as an office procedure, usually only takes 1 or 2 hours, and the patient walks into the office and leaves within those 2 hours. This consists of introducing a laser fiber into a vein in the leg and then passing that fiber up to the level of the groin, activating the fiber, which causes the vein to shrivel down or shrink, and over time, as the process subsides, the vein is now just a very small fibrous string in the leg and no longer contributes to the distension or the pooling of blood lower in the leg with all the associated symptoms. As you can see, these treatments are much less invasive than they used to be, and so understandably the threshold for seeking treatment of varicose veins and their symptoms should be comparably lower.